Everyone, welcome back to Arthritis at Home on Motivation Monday. This is going to be the third episode of a series of 4 that we hope you've been enjoying with Dr. Jasmin Ma. Dr. Jasmin Ma is an Arthritis Research Canada postdoctoral fellow, and she's someone that has a real passion for helping people of all abilities get active. Dr. Ma is funded by the Michael Smith Foundation for Health Research, the Arthritis Society, and the Canadian Institutes of Health Research. Her research and experiences as a registered kinesiologist and certified inclusive fitness trainer focus on physical activity, behavioral science, and integrated knowledge translation, working with people with rheumatoid arthritis, spinal cord injury, and other chronic conditions and disabilities to start and stay active. This series is really intended to be exercise snacks for you, and I'm going to let Dr. Ma tell you more. But first, I'm sure you're as happy as I am to be seeing her here today. Today on the floor, I might add. Welcome, Dr. Ma.
So today is our third week of exercise snacks, and I thought we'd switch gears up a little bit. So today, I want to share with you 2 things. Number one, my flowers. I had a student drop those off and send them to me this week, and they brought me a lot of joy. So I hope they bring you a little bit of joy too. And of course, what are we here for? Number 2, you know, we all have good days and bad days, and some worse days than others. So today I thought we'd switch the pace up a little bit and talk about some activity you can do on a day where you're just not feeling your best. So for today, we're going to focus on 3 exercises, no equipment, and if you really wanted to, you don't even have to leave your bed. So as always, what I'll try to do is to offer some exercise variations, starting from the more simple to advanced version, options for rest if you'd like, or to keep going. And again, you can press that pause button if you need a little bit more time. Likewise with the pacing, if you want to pick it up or if you want to slow it down, that is your exercise adventure, your choice. And of course, you know your body best. So listen to your body, you know your limits. So we'll get started. We can even just pretend that we just rolled out of bed. And I'm going to focus on mostly core today. So working on these abdominals, the back, focus a little bit on the glute and those muscles that are really important for keeping good posture. So we're going to take a bit of a lie down here. And what you'll notice is you can kind of fit, you know, when you just kind of lie flat and don't think about engaging your core, you can kind of fit your hand in through the small of your back. But what I'm going to get you to try to focus on is to push that low back down into the mat. And this kind of reminds me of like a, I don't know, like a vacuum seal pack where your hips are coming in towards your ribs and your ribs down in towards the points of your hips there. So you can kind of see as I take that core activation, it sort of shrinks that belly button in and you get that full contact of your back down with the floor. So this is option 1. You should feel that core activation there. If you kind of give it a little bit of a poke, you feel some tightness in your abdominals there. So that's option 1, you're here. Option 2, you can take that, your feet are firmly planted on the floor underneath your knees, and you can take that into a glute bridge. So you're here, raise up, and you'll start to feel that activation not only in the abdominals, but in the glutes and hamstrings as well. That's option 2. Option 3, keeping those hips level, raise one leg and slowly lower back down as best as you can, trying to keep those hips level. So choose your option 1, tilt, flat back, core tight. Option 2, into that bridge, you can take that up and down. And option 3, a leg raise and lower. So that's exercise 1. Exercise 2, we're going to start in that same position. So again, let's get that vacuum seal. Have that back contact the floor. You should feel those abs tighten. Option 2, you can come into a dead bug. So bring your knees up while keeping that back flat against the floor, still feeling that core engaged, and bring your arms up. That's option 2. Again, if you're activating your core, you should feel your abdominal squeeze here. Option 3, extend, opposite arm, opposite leg, while keeping that contact flat. So that back is still flat. And you can choose how far you want to take that. Maybe here, or all the way down. Great. Now we're really ramping it up by sitting up. And this I really love. You can do this on a day-to-day basis, especially if you work at a desk. We're all guilty of this. A rounded shoulder. We all do it. And so my cue for you here is to think about those triangular bones in the back, your scapula. Think about squeezing them in towards your spine and down. And I almost like to think that I have a pencil sitting on my spine and I want to squeeze and hold that pencil down. So I find it helpful to roll the shoulders back, to squeeze those scapular, those triangular bones in the back together, and make sure they stay down. What we love to do sometimes is let those shoulders creep up. Let's let them stay down. So option 1 here is to roll the shoulders back and squeeze those scapula down and together. Option 2, you can bring your arms out. I call this the stick 'em up exercise. And if you were sitting against a wall right now, you would have contact, or as close as you can, with your shoulders, elbows, and your hands, as close as you can. Option 3, we're raising above head or just up to shoulder height and back down while maintaining that squeeze, holding that pencil in the middle of our spine and keeping those shoulders down. So I'll show you what that looks like from the side and the back. Again, roll those shoulders down and back, up to the side, squeeze, 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 while we raise up and down. Okay, so that's round 1. Let's do that together. And again, if you want to take this time to pause and take a rest, we can absolutely do that. Likewise, in between the exercises, that's your choice. So we'll start with exercise 1. So our glute bridge, option 1, tilt, vacuum suck, contact with the floor. Option 2, up the glute bridge. Option 3, and we'll be here for 30. And 5, 3, 2, 1. And relax. Exercise 2, option to rest here. Option 1, that tummy tuck. Option 2, arms and legs raised. And option 3, extend opposite arm, opposite leg. Choose how far you want to take that. But maintain that back contact with the floor. We're here for another 15. And we've got 5, 3, 2, 1. Coming up to our seated position. Let's do those scapular retractions. So option 1, just squeeze those shoulders down and back. Option 2, arms are out to the side, kind of like you've been squished against a wall. And option 3, keeping those shoulders down and back while raising. Let's hold here for another 15. And 5, 4, 3, 2, 1. So that's it. 3 exercises. If you wanted to, don't even have to leave your bed, no equipment. And if that's enough where that's where you want to end today, you know that something is better than nothing. And if this is kind of spark the plug where you want to do a little bit more, you can check out our weeks 1 and 2 if you're feeling a little better. That's it for me today. We'll see you next week for our last exercise snack. Take care, everyone.
That was incredible. And let me just close by asking you a couple of questions. When you think about what we did in week 1 and 2 and how this fits in, one question I had as I was following along was, how do I do like episode 1 and then do episode 3 the next day? Like, how often would you recommend doing what are really, sort of almost isometric or isotonic kind of exercises to complement those where you do get your heart rate up? What's the ratio?
That's a great question, Cheryl. And so there's a couple ways to look at that. One is the guidelines. So the guidelines recommend you do 150 minutes of moderate to vigorous aerobic activities. That's the stuff that gets your heart rate up, that cardio activity, and then strength training at least twice a week. So those things that are designed to strengthen your muscles. Now, that being said, I think the best prescription is the one that people can participate in the long term. So just because those are the guidelines doesn't mean that's where you need to start. Specifically looking at those exercise videos that we've done so far, this one that we do today, you could even do before we start any of exercise 1 and 2. Stabilizing that core is it's really the core of where we're starting. So you can absolutely start there. In terms of the ratio, it's fantastic if you can do both. And of course, incorporating rest days. But, the ideal is if you can do both aerobic activity and strengthening at some points during the week. And again, listening to your body, because some days are better than others, some weeks are better than others. And to be happy for doing something rather than nothing.
Thank you so much, Dr. Ma. You had my attention right when you said you can do these in bed. So that's terrific, everyone. Thank you so much for tuning in. That's episode 3, as Dr. Ma mentioned. You can add this one to the other 2. You can push the first two episodes together to have 30-minute exercise snack, bit of a heartier snack, if you will, and then add this one either before or on its own. Really excellent core strengthening, which we all need, but particularly those of us who are dealing with some type of musculoskeletal condition or disease. So until next time, we want you to be safe. We welcome you back for Wednesday, Wellness Wednesday with Maya Joshi, and back again on Facts Friday. So until then, thank you so much. And please show up again next Monday when we have episode 4 with Dr. Jasmin Ma. Be safe, everyone.
Bye.